San Francisco has done something very creative to address an intractable problem, and I want to thank Abby Yant and Eileen Barcy with Dignity Health for leading a somewhat quite extraordinary path to address the problem of ED overcrowding due to alcohol abuse and sharing their work with me. Here's an example of what the emergency department rate due to alcohol abuse looks like, looking at years 2009 through 2011. And you can see, compared to other counties in California, San Francisco is decidedly in the red. The burden is high, with 60.9 admissions per 10,000 residents, but this is actually quite typical for many urban environments that I have evaluated the data for. If we look at the problem over time, we can see that it was trending poorly and the problem was just getting worse. We see that we see the lower left map, and we can see that the whole city, the county, is in the red, so to speak, meaning that it has an overall very high rate of admissions due to alcohol abuse. But when we look at the map on the upper right, we can start to see a little bit more about the fact that there are certain neighborhoods in San Francisco that are more heavily impacted by the problem of alcohol abuse admissions than other neighborhoods. So what was the citywide solution? In this case, 50 San Francisco stakeholders came together to address a decades-old problem, costly and clogging up the emergency rooms. Stakeholders that included all aspects of health, but went far beyond to include law enforcement, emergency response, and city planning. As a result, the Sober and Respite Center was created, which is really a step-down medical facility to handle the chronic inebriates. In order for this to work, a van service was created that would provide transport to the Sober and Respite Center from police or with ambulance crew handoff. There are 10 to 14 inebriates diverted from emergency rooms, emergency departments every single day, 365 days a year. It's really quite a creative solution and a huge success. They've reduced citywide costs for chronic public inebriates. And the ingredients that solve this problem were the statewide hospital data that really held the story, the ability to visualize it in maps and see where it was most heavily impacting folks, and then I think hugely important is the multi-sector, collaborative, and citywide solution. I'm only aware, it's only been documented that I've seen one negative consequence of this solution, and that is one death from a participant in the Sober Center across 7 years of operation. And given a high-risk population, that's actually a pretty low amount of a negative outcome. So let's put this into dollars. The financial benefits for this center were very huge for the city. The daily operating costs for the Sober Center is less than $2,700 a day, somewhat equivalent to an ambulance ride and an ED visit. If you add that up over 365 days per year, we get an annual operating cost for the center of about $1 million. The approximate cost avoidance of all of the individuals who've been seen in the Sober and Respite Center diverted from the emergency departments is $9 million a year. This is a really huge savings for the city of San Francisco and allows the emergency departments to function and treat those types of patients that really need their services. So I have a few takeaways to just emphasize that there's a spectrum of population data that is invaluable for strategic planning. In order for it to be valuable to your organization strategically, you'll need to work cross-functionally to apply the data to internal strategies, which will then improve outcomes and reduce costs. Further, it's important to work with all impacted community stakeholders to develop holistic solutions and leverage additional resources beyond your institution. All that you really need are a data platform or perhaps some help in applying the data.